You bring your beautiful newborn home. You admire their tiny fingers, their cute nose, and their soft skin. But then, a few weeks later, you look at their head and see something that looks, well, a bit like dragon scales. It's yellow. It's crusty. It looks oily and dry at the same time. Sometimes it smells a little funny. And if you are like most parents, your immediate reaction is panic. Is it an infection? Is it because of poor hygiene? Did I wash their hair too much? Or not enough? Welcome back to our channel. If you are dealing with these crusty patches, take a deep breath. This is cradle cap. It is one of the most common skin conditions in newborns. In fact, nearly 70% of babies in the US will get it at some point in their first 3 months. It looks uncomfortable, but here is the good news. It is not painful, it is not itchy, and it is definitely not contagious. In today's comprehensive 15-minute guide, we are going to become experts on your baby's scalp. We will explain exactly why this happens, the controversy about using olive oil, and most importantly, I will walk you through a gentle, first-step spa routine to remove those scales safely without hurting your baby's delicate skin. Let's dive in. To treat cradle cap properly, we first need to understand the biology behind it. The medical term is infantile seborrheic dermatitis. It all starts with the oil glands, known as sebaceous glands. These glands are attached to the hair follicles and produce an oil called sebum. Sebum is good. It keeps the skin waterproof and healthy. However, towards the end of pregnancy, the mother passes a large amount of hormones to the baby. These hormones stay in the baby's system for weeks or even months after birth. These lingering hormones send a signal to the baby's oil glands to go into overdrive. They start pumping out way too much oil. Now, normally, dead skin cells dry up and fall off naturally. But on your baby's scalp, there is so much excess oil that it acts like superglue. The dead skin cells get trapped in the oil, stick together, and dry into those thick, yellow, crusty plaques that you see. There is one more player in this drama: yeast. We all have a natural yeast on our skin called malassezia. This yeast loves oil. Because your baby's scalp is now an oil buffet, the yeast grows more than usual. This can cause mild inflammation, which leads to more shedding of skin, creating more scales. It's a cycle. Understanding this helps us realize that scrubbing harder won't fix it. We need to dissolve the oil and gently lift the flakes. Before we start the removal process, we need to pick our tools. The most common advice from grandmothers is, just use olive oil. But wait. Modern dermatology suggests we might want to rethink that. Olive oil is high in something called oleic acid. Remember that yeast we talked about earlier? That yeast feeds on oleic acid. For some babies, using olive oil can actually feed the yeast and make the cradle cap worse or redder. It disrupts the skin barrier. Instead, pediatricians often recommend coconut oil or plain mineral oil, baby oil. Coconut oil is excellent because it is not only a great moisturizer, but it also has mild antifungal properties. Mineral oil is also safe because it is inert. The yeast cannot eat it, so it simply works to soften the scales without fueling the problem. For severe cases, there are shampoos formulated specifically for cradle cap that contain salicylic acid or parithione zinc. But for most babies, natural oil and a gentle brush are all you need. Now, let's get practical. Here is the safest, most effective routine to remove cradle cap. I call this the baby spa method. You should do this before bath time. Step 1, the soak. Take your chosen oil, coconut or baby oil, and massage a generous amount onto the crusty patches. Don't be shy, saturate the scales. Now, the most important part, wait. You need to let the oil sit for at least 15 to 30 minutes. Imagine trying to wash a pan with burnt food. You have to let it soak first. Step 2, the brush. After soaking, the scales should look a bit darker and feel softer. Now, take a specialized cradle cap brush or a brand new soft toothbrush. Gently, very gently, massage the scalp in circular motions. Do not scrape. Do not pick with your fingernails. You are just trying to lift the edges of the scales. Step 3, the washing tin. Now it's time for the bath. With the baby's head and apply a mild baby shampoo. You need to wash thoroughly. Rinse very, very well. Step 4, The dry. Pat the scalp dry. You might notice that not all the scales came off. That is okay. Do not try to get it all in one session. This is a process. Usually, you can handle this at home. But when does cradle cap become a medical issue? You should call your pediatrician if you see bleeding, spreading, or if it smells foul. In these cases, your doctor might prescribe a mild steroid cream or an antifungal cream to help clear it up. So keep an eye out for those warning signs. The most important thing to remember is that cradle cap is temporary. For most babies, it completely disappears by their first birthday, even if you do nothing. It bothers you more than it bothers them. You are doing a wonderful job. If this guide helped, please like and subscribe. In our next video, we tackle how to cut baby nails without cutting fingers. Thanks for watching,